The HEAR-Lab aided cortical assessment and cortical threshold estimation modules offer aided and unaided cortical auditory evoked potential testing. The main application focuses on client groups whose responses to behavioural tests are unreliable. The technique can be used to verify hearing aid fitting in infants and young children and to estimate auditory thresholds in adults who are unable or unwilling to participate in pure tone audiometry. Although it is possible to record cortical potentials while the participant is asleep, the response morphology alters substantially and becomes more variable, so testing while the participant is awake and alert is recommended. However, when testing young infants or children, keeping the subject attentive can present some practical challenges for the audiologist. Good distraction is therefore an important part of auditory evoked potential testing. The following training video will provide some general suggestions for the audiologist to consider when preparing and testing for this population. It is hoped that this information may provide useful guidance, particularly for clinicians with less experience in paediatric audiology, or those who are new to using electrophysiological assessment techniques with young children. For more information on how and when to use the aided cortical assessment and cortical threshold estimation modules, please refer to the HEAR-Lab manual. As with any evoked potential test, thorough preparation of the recording site is necessary before the application of electrodes. Good distraction will form a central part of this preparation. Attaching the electrodes is potentially the most challenging part of the test procedure, so approach the preparation confidently but not too forcefully. Smile and talk to the child reassuringly. Try to build some rapport with the child. A little physical interaction with the child while you are interviewing the parent can be useful in gauging how they will react to the preparation for electrode sites and may possibly help the child accept it more readily. Electrode sites are generally prepared by abrading with a cotton bud and a medical gel intended for the purpose. Alternatively, a sterile gauze pad can be used instead of a cotton bud, which will allow a greater surface area to be prepared for electrode placement. Rub firmly and vigorously enough to cause a slight redness on the skin surface, but not so hard that the child becomes obviously distressed by the sensation. Rubbing gently but firmly back and forth works better than dabbing at the skin. Work as quickly as possible and minimise the number of physical contacts with the child. Don't fuss or overdo it, but be mindful that it is better to prepare the skin thoroughly than to have to repeat the whole process. If the child needs reassurance about the preparation, modelling the procedure by rubbing the forehead of the parent or a doll with a cotton bud and sticking on an electrode can be helpful. Try letting an older child have a turn at putting an electrode on a toy or on their parent. A single channel recording is sufficient for these evoked potentials, with the black ground electrode positioned on the forehead, the yellow channel 1 electrode on the top of the head, and the blue reference electrode attached to the mastoid behind the ear. Use a liberal amount of electrode paste under the yellow electrode, even if a disposable electrode already contains conductive gel. If using disposable electrodes, a spot of double-sided tape, the type used for retaining hearing aids, on the underside of the plastic tab of the electrode stud can give a firmer hold, particularly for mastoid or forehead sites. A headband is very helpful in keeping the electrodes in place, but some children don't immediately accept wearing it. To make wearing a headband more appealing to the child, choose colourful, soft and stretchy materials. Give older children a choice of colours or designs, and use fabrics that are easy to wash and dry after use. Television can be a good distraction during electrode placement. Use a range of children's DVDs with lots of colour and movement. If the child becomes interested, the DVD can be left playing with the sound muted when testing starts. Whenever possible, have a trained distractor in addition to the parent to interact with the child during electrode placement, as well as during testing. Toys that involve some fine motor manipulation, for example block stacking, can help keep hands away from the electrode sites. Once the electrodes are attached, try to drape the leads behind the child, avoiding contact with the child's face or neck. If the child can feel the leads, they will be more inclined to pull at them. Before acquisition commences, an impedance check will verify the adequacy of the electrode application process. With acquisition underway, the examiner can verify the current stimulus and presentation levels. The ongoing data acquisition can be continually monitored via the HearLab acquisition window. More information on how to perform evoked potential assessment and verification of hearing aid fitting using HearLab can be found in the manual and on the help function within the HearLab software. Throughout testing, the child can be kept quiet but alert with a variety of age-appropriate toys or a silent DVD. For very young infants, the main aim of distraction is to keep them alert and awake, since they do not have the motor skills to pull at the leads or electrodes. Books and hand and finger puppets are all useful items. Visual novelties like toys with lights and motion can be a good source of distraction too. Some mechanised toys are too noisy to use while the testing is in progress, but can be good to use during breaks in order to regain a child's interest and increase alertness. Toys that are used for visual reinforcement orientation audiometry are generally suitable for children in the 7 to 24 month age group. Examples include stacking plastic rings or cups, farm animals, large counting and threading beads, puzzles, colourful teething rings, and so on. Items that keep hands occupied are ideal for children old enough to manage them. For younger children, or those who are not developmentally ready to play with items, toys with texture, like spiky plastic balls and plastic animals, can be interesting for the child to touch or mouth. Make sure you put them in the washing container for cleaning after use. For older infants, around 24 months and over, try colouring books with big colourful crayons, Play-Doh, paper with stickers, or self-inking stamps. Books can be good for children of all ages. Heavy cardboard books of various shapes or with pop-up features can provide hands-on activity. Almost every child enjoys watching bubbles being blown. The small bottles used for parties are inexpensive and easy to use. Eating and drinking are excellent distractors. Good choices include baby bottles or infant sipping cups, and soft foods such as bananas, custard, fruit gel or sultanas. Avoid hard foods such as crunchy crackers or large pieces of food that require a lot of chewing, as the resulting noise and jaw movements can affect recordings. Breastfeeding is good for calming infants, but often can induce sleep. If the baby must feed during the assessment, watch very carefully and rouse the child gently if they begin to doze off or if their eyes start to appear unfocused. Be prepared to pause testing if the child's state becomes inappropriate. Sometimes a short break to have a feed can give the baby a boost to keep them going for a bit more testing. Avoid distraction activities that are too stimulating or that encourage increased vocalisation. It will be important to monitor the state of the child throughout testing, as electrode contact can be compromised if the child becomes overheated and sweaty, and it may be necessary to remove clothing to cool them down. Suggest that the child be dressed for the assessment in layers of clothing that can be easily removed. It is better not to have to pull clothing over the child's head once they are wired up. If test conditions are not ideal, there is the option of pausing and then resuming once a favourable condition has been restored. Once testing is complete, it will be important to remove the electrodes gently. Thoroughly clean the skin after removal using clean water. Harsh agents such as alcohol are not recommended. For more information on how and when to use the aided cortical assessment and cortical threshold estimation modules, please refer to the HEAR Lab manual.